Good day, students. My name is Fayemi Azimolabanji. I am your personal teacher for Civic Education, and I will be teaching you HIV/AIDS on the topic of HIV/AIDS. Firstly, what's HIV/AIDS? Firstly, what's the full meaning of HIV? HIV is human immunodeficiency virus. Okay, it's a virus that attacks the body's immune system, specifically the CD4 cells, which is the TD cells, which is the T cells, which help the body fight off infections. One, if untreated, HIV reduces the number of CD4 cells, making the person more likely to get infections or infected related to cancers. Okay, what is AIDS? AIDS is acquired immunodeficiency syndrome. The most advanced stages of the infections, it occurs when the immune system is badly damaged due to the long-term HIV infections, characterized by the presence of certain opportunistic infections or cancers. Thank you.
Hello students, my name is Kobadian Merit Osagedua and I'm your personal teacher on Civic Education, and I'm going to be taking you on the topic of HIV and AIDS. We'll be looking at the causes of HIV and AIDS as well as the difference between HIV and AIDS. But firstly, what is the full meaning of HIV? The full meaning of HIV is human immune syndrome. Human immune syndrome. While the full meaning of AIDS is human acquired syndrome. Human acquired syndrome. So, what are the causes of HIV? One is having unprotected sex. When a person is having unprotected sex with an HIV patient, that person is likely to contact HIV. So, one of the ways a person can contact HIV is having unprotected sex. Second one is from mother to child. And how does this happen? When a mother who is an HIV patient gives birth to a child, through that birth process, that child can contact HIV if it's not properly handled by the doctors. Because research has shown that there's a way to prevent a child from contacting HIV from the mother. But if it's not properly handled by these doctors, the child can contact HIV. Second, another ways whereby a child can contact HIV is through breastfeeding. Yes, through breastfeeding. So, mother to child is one of the causes of HIV. Second is sharing sharp. Third is sharing sharp objects. Sharing sharp objects like razor blade, needles, you can contact HIV. So, fourth one is the blood transmission. When a person is having shortage of blood and an HIV patient happens to gives blood to that person, that person can contact HIV. So blood transmission is one of the causes of HIV. Now let's move forward to the causes of AIDS. What are the causes of AIDS? AIDS is the advanced stage of HIV. AIDS is the advanced stage of HIV. AIDS happens when HIV is not properly treated. When HIV is not properly treated, it advances to AIDS. So what are the causes of AIDS then? The causes of AIDS is lack of treatment. When HIV is not treated, it causes AIDS. It leads to AIDS. Now let's move forward to the difference between HIV and AIDS. HIV is a virus, while AIDS is the condition. HIV is a virus, AIDS is the condition. HIV can be treated. AIDS cannot be treated yet. HIV can be managed. AIDS cannot be managed. An HIV patient can live freely without anybody telling if this person is actually an HIV patient. But an AIDS patient cannot live freely. Everyone will know because all the symptoms is written all over that person. Note, not everyone with HIV ends up an AIDS patient if it's properly treated. I will say it again. Not everyone with HIV ends up as an AIDS patient if it's properly treated. Now, this brings us to the end of our class. Thank you.
Good day, students. My name is Arishin Oluwatobi Solomon. I am your personal teacher, and I want to teach about symptoms of AIDS, which is the advanced HIV. Number one symptoms of AIDS we have here is rapid weight loss, which is the reduction in the normal size of the body and the shape, even in weight. Anyone who is infected with the disease will definitely reduce in body, in shape and weight. The number two there is frequent fever or sweat at night. You see, anyone that is infected with the disease will be feverish, even at night, without doing anything. The person will be waiting, will be doing what, will be sweating. Even without doing any work, the person will sweat at night, which can also cause fever. Another one there is extreme tiredness. Even without doing anything, the person will just feel tired. To pick up something, the person will do what? Will just get tired, just like that. Prolonged swelling of lymph glands. We all know in the white blood cells, the lymph gland is responsible for regulating the circulatory system. It provides blood. Now, anyone who is infected with this disease, we have swollen lymph glands, which is dangerous to the cells. Another one there is diarrhea lasting more than a week. The person will have the infection called diarrhea, which cannot be healed easily, like that. So diarrhea lasting up to a week is also one of the symptoms of AIDS. Another one there is sores in the mouth, arms, or genital. You see, the person won't be able to eat well due to the sores, like wound injuries in the mouth of the person. Another one there is pneumonia and memory loss or depression. The person will feel depressed no how, because people won't want to come close to them due to the disease that they have. So they will be depressed, and again it causes memory loss because they will forget things easily. Another one there is opportunistic infections. Anyone that is infected with the disease, it said the person immune system will be weak, and when the immune system is weak, there will be opportunity for any infection, any disease to enter to come against the body, because the immune system won't be able to fight back due to the weakness. And now let's talk about the effects of HIV/AIDS. Effect of HIV/AIDS. Number one, it weakens the immune system, making body prone to infections. Yes, when the immune system is weak, the body is open to different kind of infection or disease, because the immune system protects the body. It protects the body from acquiring diseases. The second one there is it leads to long-term health complication. Yes, long-term health complication. The person health won't be stable, so it will be complicated. Automatically, the health is damaged. Another one there is it impacts social and economic life. How? You know, anyone infected with the disease, so people won't want to get close to them. So it causes loss of relationship, even work. And the last one we have here is it can be fatal if untreated. What do they mean? What do I mean by fatal? This fatal, that it can be more brutal when it is untreated. When HIV is untreated, it leads to AIDS, and when it gets to AIDS, automatically the person days are numbered. Thank you.
Good day, students. My name is Ifeanyi Uzoma Caroline, and I'm your civic educator for today. So we're talking about modes of transmission. HIV can be transmitted through unprotected sexual contact, sharing of needle, mother to child, and blood transmission, occupational exposure. Note that HIV is not spread through this following: hug, kiss, sharing of food, mosquito bites. Early symptoms of HIV. Acute stage: 1. Fever, fatigue, rashes, sore throat, and swollen lumps, headache, and muzzle. Thank you.
My name is Aaron Olofia Besu. I'll be a personal civic teacher on HIV and AIDS. I'll talk about how to use condom to prevent HIV. Condom play a crucial role in preventing of HIV disease and other infections. And we have three behavioral risk factors. 1. By having multiple partner sex. By playing with sharp objects and syringe and needles. And lastly, by having unprotected sex. We can stop the risk of having HIV by having protected sex, by using condom, and not playing with sharp objects, by abstaining from sex,